All right. Good afternoon. It is 4 o'clock. A forum is present. And the May 17th meeting of the Nantucket Board of Health is now open. Just to remind you that this meeting is being audio and visually recorded. Is there any comments from the public on any item that is not on the agenda today? We will move on then to the minutes of April 26. Those have been distributed to the board. Does the board have any questions, objections, deletions, or additions? Do I hear a motion to approve?
So moved.
Any further discussion? All in favor of approving the minutes, say aye. The minutes are approved for April 26th of this year. Roberto, your report.
Yes. So over the past month or so, we've been starting our general, what we called the road show last year, where we started meeting with all of the town associations and all the groups that are around the island. So last week, we connected with the Nantucket Builders Association, where I gave them an overview of where the sewer projects are laying, where the septic system regulations are, an update. It was for CEUs for some of them, an update on septic systems, IA regulations, and where we stand there. Rob McNeil was there to talk about the projects that DPW is working on, and we gave them the brochures and the information on the illegal dumping, with all the dates of the hazardous waste days and things like that. And then today, I connected with the Winter Group, and I discussed the community health assessment that we did last year. I gave an explanation about some of the relics in the data, about small sample sizes, things like that, and where we stood on things other than tick-borne disease. So one of the things I was explaining to them is we all know that tick-borne illnesses are a problem on the island. So a lot of times they overshadow the other things that are happening. So I made it a point to emphasize the projects we're working on to prevent marijuana use and vaping in the youth in the schools, some of our cancer statistics, and general strategic plan processes, things that we don't typically get a chance to talk about because they're overshadowed by the other issues. Both of those presentations were well received. And then I was talking to DPW. I confirmed with them Vector Disease Control International, VDCI, has started their larviciding program for mosquito control. So they've started larviciding some of the wetlands around the areas, and they're starting to monitor all the equipment for mosquito activity. The tick-borne. Sorry. Yes, sir.
Can we ask questions as we go along?
Perfect.
So when they identify larvae, what do?
There's a corn-based product they grow. It's called BTI. I don't remember the scientific term for it. That is on corn that they drop into where the larvae tend to grow. So in any of the ponds and little areas of standing water, they will put this BTI in there, and it'll kill off the larvae for the mosquitoes. So a single mosquito can lay thousands of eggs. So when they drop the larvicide in there, what it does, it creates a small sheen at the top of the water, and it doesn't allow the larva to breathe. So the larvae suffocate, and there's less mosquitoes. It's very effective, and it's non-toxic to humans and to other animals. Tick-borne illness diseases monitoring continues. As of today, I ran this report today. There are no cases of amoebiasis, babesiosis, ehrlichiosis, anaplasmosis, or Rocky Mountain spotted fever. No cases of tularemia. 6 cases of Lyme disease, and then there is 1 case of another tick-borne illness. But due to HIPAA, I can't say what it is because it's only 1 case. That'll be identifiable. But it's still a pretty slow season. We expected it to be a little bit more right now, so we're kind of surprised that there's only 6 cases on the island so far. And that's confirmed suspect or probable. We've checked that's on among all three. And then I've been working with David Gray and the Weston and Sampson group to work on a fats, oil, and grease program. We've been identifying products and processes that can prevent these issues from getting into our pump stations and into our sewer line. We had a great meeting today with Weston and Sampson talking about a new biological a proteolytic compound that actually breaks down the grease and prevents it from congealing in our sewer lines. So that's a program that we're going to be looking into and seeing what the feasibility of that would be. Because some places downtown, they just don't have the space to put in a grease trap, the large grease interceptors. And in the areas of high groundwater, we can't put it in there either. So this proteolytic compound might be a good alternative. And then lastly, we have the MIT presentation next week at the Select Board. Kevin Esfelt will be here with Joanna to give a presentation on Wednesday, the 23rd. And then immediately following that, the NOVA series that was filmed here last year will be airing on PBS at 9 p.m. on Wednesday night. And then I believe, yes, sir.
Do you want the board to, is this for information, for feedback, for action? Are you looking for some kind of, what are you looking for from the select board after this presentation? Or what's Kevin looking for?
So this is a kind of a double presentation. It's for providing the information and a progress report of where they're at, but they're also looking to get as much feedback as they can. They're always looking for questions that they can answer and any feedback that they get from any other regulatory agencies. So it's
and they look at the select board as the elected representatives of the town, and they've had feedback from the public at large and from individual people from the steering committee, but not from the elected officials.
Okay, good.
Because you will ultimately perhaps have more role in this.
Okay. All right, great, thank you. I'll make sure we bring that forward then.
Yes, please do.
And then I also believe that the steering committee had a small.
Well, yeah, the Dr. Dickler, who's the chair of the steering committee, and Joanna, who's Kevin's, fellow and project coordinator. We just talked on the phone, and he will also be here in August for a public forum. And the usual discussion is what time to have it, how will we get the most people there, and so forth. So,
Serve food.
serve food.
That's the easiest way to get
Well, there was discussion about that, but we didn't think that was a good idea. So that will be sometime in August.
Great.
And you will also have a public forum in August for the health issues.
Yes. So the other thing that I want to propose to the board is so that we can start thinking of dates of whether the end of July, mid-August, early August for our presentation that we've done. This would be the third year that we're doing it now, I believe, on any recent updates on regulations, any changes, any public forum type of information that we can get out to the public. Last year we did the presentation on the well water testing regulation and the updates on the septic regulations. I think it would be a good idea to do the septic regulations again and maybe discuss part of the marijuana upcoming in that the town meeting. So it might be a good idea to discuss all that. So it's just a time of when we should. It's once again the same question of what time, when, and where. So we can probably set that appointment up at our next meeting at the time if we can start thinking of.
Right, and any input anyone has on the best time to hold both of these forums would be appreciated.
Yes.
Do you remember when we did the one last year?
Last year, I believe, was the first week of August. I believe it was right before the Boston Pops.
Okay.
That week.
And that was well attended, I believe.
That was pretty
Yeah.
well attended.
It was well
Mostly year-round people, though. It was a little interesting to see that even in the summer, some of the summer residents didn't come, no matter how much we pushed out information. And that's all
That's
I
it.
have right now for the.
I did get a compliment last week from a woman who said she's really noticed fewer mosquitoes in the last 2 years.
That's great. Yeah, VDCI has been really good. That's why it's been so important to keep local control. So they've been really great.
Yes, that was very important.
Do we have a plan for any type of educational publication on the tick-borne disease? It's been getting a lot of notice in the nation and statewide news. And I know Jim Lentowski wrote a letter to the editor, I think 2 weeks ago.
Okay.
Do we have a
Do
plan?
you remember if that got published? Because I don't remember seeing that in the Yankee.
It was, yeah.
Jim's letter
was
2 or
last
3
week.
weeks
Okay,
ago.
it was
yeah.
last week? Okay.
Yeah, it was a letter to the editor.
Yeah, it was a letter to the editor. I just didn't remember seeing it. But yes, we do have form letters that we have written before to get the information out, and we're also pushing a lot of information out to the landscapers. They're our most at-risk population.
And I've seen our video on Channel 18. I don't know if
and,
Dreamland would do it again. I think
it's
it's
being-
educational. We can do it.
It's being pushed on Channel 18, and I know Gino is also pushing it on Gino TV. I could talk to Joe and see if he can put it on the Dreamland again.
Yeah.
Yeah, just the short one.
Yeah, he was running. They ran it last summer, so it shouldn't be an issue.
There's no cost if it's public education.
Yeah.
So.
So, you have a comment?
Yes,
Comment.
yes.
So, if you're looking for a way, I'm sure you've already thought of this, but a good way to reach out to the summer community is the Association of Non-Voting Taxpayers. They have regular meetings, are often looking throughout the summer, and they get a pretty good crowd, and they're often looking for speakers.
Oh, excellent.
I'd be glad to do that if
That'd be great.
If we if you reach out to them and find a time.
Probably Erica would be a good contact for that.
Sounds good.
Okay, back on the agenda. The first item for consideration is variance request of Regulation 33 from Gray Lady Smoke Shop would like to sell cigars at the wine festival.
Yes. So we have a regulation request, variance request for the Gray Lady Smoke Shop. The regulations, as we have written, limit their location of sales to just the store. And they're looking to ask for a variance to get a booth at the wine festival this weekend.
Comments from the board? Questions?
I don't know if there's a representative here for that. Is that you? Okay.
And this would only be for this weekend.
It would be just for this weekend.
I have no problem with that.
Okay.
Personally, selling smoke products approved by the Board of Health is kind of a,
Well,
so
it's a 2-day thing.
I understand. Okay.
But we don't allow smoking in public,
public,
so
right.
they can't,
They can't smoke in that's true.
It's
and that's going to be the thing.
And this
Bars,
year,
you can't smoke them.
the wine festival is at Jetty's.
Oh, well, that's a problem then, because then we
Yeah.
have another regulation about smoking on the beach,
Right.
which we
Yeah, the wine festival is at the Jetty's parking lot.
was a bit controversial at the time. So I would be concerned about that then. Hank, you had a question? Or not Hank? Sorry, I'm not functioning.
More of a statement that,
Yeah.
it's all public property, town-owned property,
Yeah.
beaches.
I agree. It would be in violation of another of our hard-fought regulation
Yes.
for smoking on the beaches. Any other comments? We hear consensus. We probably will not approve this variance.
I'll make a motion to not approve the variance request. Deny, I guess.
Further discussion? The vote is not to approve the variance request to sell cigars this weekend. All in favor, say aye. Aye. Chairman says aye. Uh, 16 Folger. Request to allow shared system.
Yes, so this is a subdivision at 16 Folger. I believe one of them is about just over 10,000 square feet. The other one is 28,000 square feet, if I'm correct. And then I believe Marianne is
For the
here as the
applicant,
representative.
Marianne Hanley, Clarjo LLC, Pat Levesque is here, he's the principal. What we're trying to do is to subdivide this property so that we can create a year-round housing covenant lot, as well as a market rate lot. And under the requirements of the planning board, the covenant lot has to be at least 40% of the required zoning, so that's a almost 17,000 square foot lot, 16,819. And the remaining lot would be 26,332. There's an existing 4-bedroom system on the property. Currently, there's 2 cottages, each of which has 1 bedroom. We are going to restrict Lot A, we have to just 1 bedroom because of it's just over 10,000 square feet. We had thought we could utilize the other 3 bedrooms capacity on the other lot, but our TEL said no, because it's only 26,000 square feet. So we will limit the Lot B to 2 bedrooms, one of which is constructed and one that we're hoping to add on to the house or do a tertiary dwelling, one or the other. But this property is also located out in the Badlands, and an extension to the town sewer system was approved at town meeting, but it will be a private sewer system. We hope it gets installed sooner rather than later, and then the use of the system will go away, but it is private. It's going to require design, construction, and getting funds from all the neighbors. So rather than wait, my client has a guy that works for him that needs a place to live and would like to buy the lot. The only other thing that I can mention is there's 1 well on the property now. There will be 2. Each of these lots will have their own well.
Comments from staff and then the board?
So Title V has parameters for shared systems, and everything they've submitted is in compliance.
Right.
Some of what you have has changed.
What's changed from what we have?
Like she just said, they knocked down the 28,000 square foot lot to 2 bedrooms rather than the 3.
3. Excellent.
And so from there, all we need is a stamped engineered plan and the deed restrictions, and we would recommend to approve this.
Questions from the board?
Will there be basements in these houses?
There isn't currently.
Just identify yourself and ask.
Pat Levesque, 16 Folger. There is not currently basements there, but there's room to be able to expand on the market value lot. There would be potential to be one there, but as of right now, no, there's not.
And would you have a bathroom in that basement?
Potentially.
As far as with the septic systems, it would count as an extra bedroom. But once sewer gets out there,
So once it's sewer,
the restriction is lifted.
Okay, that's good.
All right, do I have a motion to approve or disapprove this
I'll move
variance?
to approve.
Further discussion? I'll approve. All in favor of the approval for 16 Folgers, say aye.
Aye.
Chairman says aye. The variance is approved. The next variance request is for 3 North Point.
Yes. So in this case, 3 North Point, there is a renovation that's happening on the property that is triggering the installation of an IA system. They're asking for a variance to not install the IA, and I believe Paul Santos is here to represent the owner.
Thank you. For the applicant, Paul Santos with Nantucket Surveyors, on behalf of the property owner, Sherry Matarese, who is seated in the back of the auditorium. As Roberto had said, this is a variance request from Town of Nantucket Board of Health Local Regulation 64.04B1 for the above referenced property, specifically a variance from section 64.04B1 in order to maintain an existing 5-bedroom septic system on a pre-existing non-conforming lot without the need to install a DEP-approved nitrogen reducing technology. Now, the property has been owned by the Matarisi family, which is the party in interest to this application, prior to the adoption of Local Regulation 64, which was January 1st in 2005. So the subject site, 3 North Point, is located in Fisher's Landing subdivision, which many of you, I believe, are familiar with. Fisher's Landing was an 87-lot cluster subdivision located in Nantucket that was approved by the Nantucket Planning Board and the Nantucket Board of Zoning Appeals in May of 1977. It was at that time approved essentially as a cluster. It was a clustered subdivision concept in which the lot sizes were ranging anywhere from 10,000 to 23,000, depending upon where within Fisher's Landing you were located. Initially, the subdivision was to be serviced by well water. Some of the initial wells were put in place. However, at the time, they eventually ran water to the subdivision, and since the majority of the lots have been developed with town water, the Matarisi property is serviced by town water. Back around 3 or 4 years ago, I came before this board for a number of hearings in which, out of the 87 clustered lots in the subdivision, 5 of the lots are undeveloped. There were only 5 lots in the subdivision that were undeveloped. And at that time, through some lengthy hearings, we presented information that showed, in the aggregate, the Fisher's Landing subdivision meets the 1 bedroom per 10,000 square foot requirement set forth in the local regulations that affect this particular area. The record was clear on that, and the variances that we obtained for those 5 lots acknowledged that in the aggregate, that's how it would work. Now, it was not a DE-approved aggregate system. It was essentially by the fact that we looked at number of bedrooms, the acreage, the amount of open space that were allowed for the lots. So at that time, this board granted variances. I represented 4 of the lot owners. 1 lot owner, which was actually 1 lot that was held by the original developer, was not part of the application. The board granted variances to allow those 4 lots to construct a minimal amount of bedrooms. It was 3 of the lots were 3 bedrooms and 1 lot was a 4-bedroom, with the provision that they were vacant lots. Any new construction that came in would have to install an IA system. Okay. This lot itself is a little bit different in that this lot has already been developed. It is a 5-bedroom system on a lot that's approximately 12,068 square feet, in which we are now located within the Nantucket Harbor Watershed Protection District Zone A, and also we are outside any, when we look at the state regulations with regard to interim wellhead protection, nitrogen sensitive, whether the lot has a well and a septic. We are not subject to any state regulations which limit bedrooms for this particular piece of property. This is strictly the local regulation, which limits the 1 bedroom per 10,000, which was the Nantucket flow restriction component, and then also the new construction component of your regulations. So at the time that this lot was purchased and the home was built, there was no restriction on bedrooms for the particular property. So the reason that we're here before you today is the Matarisis came in recently to do some remodeling on the existing 5-bedroom structure. Currently, there exists a 5-bedroom single-family home and a 2-bedroom cottage/garage on the subject property. 3-bedroom single-family home, 2-bedroom cottage, the garage, for a total of 5 bedrooms on the property. So an application was made to the building department for renovations to the existing home, in which there was some expansion on the first floor, second floor of the existing rooms. There was, however, no additional bedrooms or additional flow to the system that was part of that request. I've submitted with the application the building permit application, in which it talks about the detailed scope of work, the north elevation bump out, left bedroom and right side porch to accommodate a mudroom, west elevation continue roof line to match the north elevation on second floor, south elevation add a sunroom, first floor extend master bedroom, east elevation roof changes, windows changes, and so forth. So it was a renovation of the existing house in which no additional rooms were added, and for the purposes of Title V, no additional flow was added. It does, however, that renovation does fall under 50.01, which is the definition of new construction under both local and state regulations. And I'll like to read that definition. New construction, the construction of a new building or an addition of enclosed square footage to an existing building for which an occupancy permit is required, or an increase in the actual or design flow to any nonconforming system or to any other system above the existing approved capacity. New construction shall not include replacement or repair of an existing building totally or partially destroyed or demolished if there is no increase in flow above the existing approved capacity to any system. So that triggered new construction falling back to 64.041 essentially triggered the need for an upgrade to an IA system under the local regulations. A plan was submitted to the Board of Health for an IA upgrade, which in this case meant the existing system is a functioning system, has a separation to groundwater of approximately 14 feet. It is a currently, not a pre-78 system, if you will. It's a current system under the current regulations that's on the site. Again, it had a 14-foot separation to groundwater at the time, and I've had testing in that area recently for one of those houses that we had a variance for, in which we found the similar groundwater separation to the particular lot. The plan was submitted to the Board of Health. It was approved. So what it meant was taking the existing septic tank and replacing it with an innovative alternative component to meet the nitrogen removal components of the local and state regulations. That plan was sent out, and prices were received for that upgrade that came back in excess of $30,000 for that tank. Now, that was just from the contractor to install the IA component. That didn't include electrical, which is probably another $1,000. Didn't include surveying, engineering, which probably another $2,500. And then once the IA system is installed, you're looking at probably a $750 a year maintenance contract that these systems require. So it was a substantial cost to the homeowner for that component to be added to a system that is functioning and where no bedrooms or no additional flow was added to the system. I think it's important to go back to, again, the record and what the findings we had under the Fisher's Landing work with regard to the total aggregate, if you would. Whereas I think Fisher's Landing is kind of unique in the Nantucket area, whereas that system, that cluster division, was basically designed at the time, not with the intent of aggregate flow, but that was the whole purpose of a cluster: set aside open space, have smaller size lots. And for the majority, most of the buildings in Fisher's Landing, with the exception of the 5 that we spoke about earlier, are basically 5 or 6 bedroom dwellings. They're 5 or 6 bedroom dwellings. The 5 that are out there now that are vacant and that we got waivers for, we were limited to one of those. We were allowed to put a 4-bedroom on. That was on West Creek Road. And then within the cluster subdivision itself, the other 3, we were allowed to put 3-bedroom dwellings on with an IA system. So on behalf of the applicant, we feel that there is a provision that allows us to come before you, ask for a special variance under 64.07. And basically, 6407 says that the applicants have established, you need to meet the criteria that the applicant has established that an enforcement of the provisions of these regulations from which a variance is sought would be manifestly unjust, considering all the relevant facts and circumstances of the individual case. And 2, the applicants requesting the variance have established that a level of environmental protection is at least equivalent to that provided under these regulations, can be achieved without strict application of the provision of the regulations from which the variance is sought. 1, I would make the case that a $35,000 to $40,000 upgrade for a system that did not increase flow is manifestly unjust, and that 2, that the circumstances for the Fisher's Landing subdivision that is of record to this board with regard to number of bedrooms, the amount of flow, and how the Fisher's Landing subdivision acts. Again, we've met that burden of at least saying that there is an environmental protection that is afforded to these existing lots in Fisher's Landing. I fully acknowledge that the vacant lots in the subdivision, those have required 5. Those 5 lots do require an IA. I think that was a different situation than homes that had already been built. And I've done, I think, at least 1 or 2 in there since that time in which IA systems have been put in, and those homes have been developed. With regard to, I know how you look at these variances with very carefully, because we don't want to set precedents, obviously. I think anybody who comes to you in Nantucket, anybody who comes anywhere else, does not have the benefit. This is isolated, I think, to Fisher's Landing. This is a case where I feel I can make this case to you because of the Fisher Landing component of this application. I'd be happy to answer any questions that you may have. Sherry is here too. I have submitted with the application the Fisher's Landing plans, also submitted the building department application and information, and happy to answer any questions that you may have.
Go ahead.
When was the current system installed?
That system was installed at the time the home was constructed, which I believe was, let me just go back here, early 2003 or 2004. Yeah. Which was post 95, which would be the current regulations that that we're dealing with.
When you received the building permit, it stated on the building permit that you would require an IA system?
In order to get the building permit, we had to submit a plan with the IA system.
Right.
Correct. That was the full intent, was to do an upgrade with the IA. The question became, excuse me, when the prices came back for the IA, they've just been gradually climbing up and up and up, and now it's been, that IA component, it was the price of the IA. That's really why we're here today.
I understand that, but all through the construction of the thing, you knew you were supposed to put an IA system in there.
Correct. Correct.
Comments? Other comments?
And what's the status of the construction project now?
Sherry, they're working on it maybe another month or so before they're completed. They would not be able to, as it stands right now, without coming from this board, they would not be able to get a CO without the IA component in place. The system itself, but they would have a period of the building permit. The Board of Health permit is good for a period of 2 years, I believe. Correct me if I'm wrong. So the building permit, so there could be a lag in between. This permit was received, say, 6 months ago. They could wait up until the end to ask for the CO and put the IA system in. They'd have 2 years under the Board of Health permit to do the work. So
And what's the total anticipated cost of the whole project?
that I can't answer. Sherry is here. I can. The reconstruction, I think, is what the yeah.
Just no. Okay.
Yeah, the total cost of improvement is on the
600.
Board of Health application is $600,000.
So if 30,000 is manifestly unjust, what number below that is just? I mean, that's what I mean. You've come to us saying that this number is manifestly unjust, but is 28,000 just?
Yeah. I mean, I can't answer the question. I will tell you
It was
this.
a rhetorical question.
We and Art and Roberto know this. We're constantly looking for something to kind of bridge between what the cost of these systems are. Whether it's still an IA. We're still looking at IA, but we're trying to come up with something on a retrofit because there's 2 types of systems that we're basically putting in now. So the replacement of a system. Replacement of a complete system with the IA, that's a certain cost. It's these retrofits where you have a system that meets the groundwater separation, is a functioning system, does not have a hydraulic failure. You're just simply inserting the IA component. Now, so your Nantucket Harbor Watershed District, this type of work is triggered by a sale of a property, new construction, a transfer of property, whereas in Nantucket, the only trigger now is the new construction, is the definition of the new construction. Or if you have an undersized lot with a well and septic and so forth. If I'm misspeaking, Art, correct me. Okay. So,
My problem with this whole thing is, from the very beginning, you knew you had to have an IA system. So you went through a $600,000 renovation, and when you got to the end of the renovation, $30,000 is too much, and you knew from the start that the building permit required an IA system when you were done. I have a problem with that.
Other comments, staff comments?
So Paul covered quite a bit of information, so I'm not going to bore you with. So what's triggered this in Nantucket is because they don't meet the nitrogen loading. It's 5 bedrooms on 12,000 square feet, so they don't meet the one for 10,000. And the new construction, which they're choosing to do, this isn't, like you said, a house has been demolished or destroyed.
Right.
They're choosing to do this addition. So the new construction, our local new construction definition is a trigger that is requiring this IA upgrade in a nitrogen-sensitive area of Nantucket Zone A. So that's the biggest piece of it. The manifest unjust, as I understand it, would be that you removed all use of the property. There's 2 dwellings there. They're using the property. It's not been removed from them. And when it comes down to what Paul brought to the board, did a lot of work with those 5 vacant or 7 vacant lots. At the end of the day, the board required those lots to have innovative alternative septic systems, and they exceed the nitrogen loading. And there's no different. It's new construction.
Yes.
This is new construction. It's the same thing. I'd just like to remind you, last month we had somebody come in Hummock Pond wanting the same thing, slightly different upgrade than this one, and staff did not recommend that variance, and we don't recommend this variance.
An IA
either.
system would reduce nitrogen load.
Yes.
Since it looks like it'll be a long time before we have sewers there. Yes.
For a while.
For a while.
Right, and I'm not going to bore you and
Thank
keep
you.
talking.
Yeah, we got
to
it.
you,
We got it.
But
I think
I think you do.
I think Paul was very clear, and I think the application was very clear, and the staff was very clear. Do we have any other questions?
Is betterment loan available, or?
The betterment loan is
Betterment
available.
loan is available.
Okay.
Very good. There is an option there. There is a betterment loan available.
okay.
$30,000 is only 5% of the total project cost.
I mean, that's my concern. All right, so may I have a motion to approve or not approve the variance?
Make a motion to decline the variance.
Do we hear a second? Further discussion? The motion is not to approve the variance. All in favor?
Aye.
Chairman says aye. Variance is not approved.
Thank you. Thank you for your time. Just if I could, as an aside, as I
Real
had
quick
said,
aside.
Roberto and we're constantly working with, we're trying to find some alternatives, like I said.
I know.
Quite honestly, I'd like to see these, if these could come in 15,000. You asked the question. In my opinion, I mean, the retrofits, if we can get them in at 15,000, I think then there's no question with, no matter what the case is.
That would be-
for a retrofit.
I think we'd all like that.
I'm going to keep, and hopefully what will happen here is we'll try to come up with something for this one, and maybe we'll modify this plan to a nitrogen-approved technology, but some new technology that comes over here, someone's willing to come to the island, service it, and then try to keep the cost down.
Well, that would
That's
be
what we're
great.
trying to-
That'd be
They're
great.
just creeping. A few years ago, this was $20,000.
I know. Well, it's
Now it's 30. Now,
well,
it's just
demand.
it's
constantly
at
going.
some point we have to look at the total cost of the island of these systems and balance that against the total cost of putting a sewer out there.
Yeah.
Yeah.
of course, the problem is different people are paying for it.
Well, we appreciate your time.
I think if we took the total cost of all the IA systems in the last 5 years on the entire island, we could put a sewer in easily. That's just my opinion. Thank you very much.
Thank you.
Someone should do the math on that someday.
Well, the other option is to have betterments
Yeah, we do have betterments.
for the sewer.
For the sewer.
For the sewer.
Yeah, that's what I mean. Yeah,
No, we don't. We don't have betterments.
What we have right now
don't.
is 100% on a tax base,
Yeah.
and then all people do is pay. But if we were to do 70% on a tax base,
agree.
and 30% betterment, that would be
I agree.
No, I'm talking about the cost to the sewer system.
Yeah.
There's no incremental cost to
there's
that
no-
other than the installation.
Yeah.
That's the sewer system is borne. The cost of that is borne by all the taxpayers,
Yeah.
not just by the taxpayers in that area.
yeah.
So it could be more of it could be a burden of the taxpayers in that area if we chose to.
Agreed.
IA request for seasonal sampling discussion.
Yes, we put that as a placeholder. We were going to come up with a proposal that it's not set yet, so we're going to ask to table it.
We'll do it next time.
Yes.
Now you have, what an interesting topic. Marijuana discussion, potential regulations, a special town meeting discussion.
Yes. So there's a potential regulation discussion that's coming up. Once again, we've voted in the moratorium. We are waiting right now, but there's more discussions about this retail marijuana situation. I had spoken to Jim earlier. He had asked what our associations are saying, our local associations. Yesterday, I did speak with the president of the Massachusetts Environmental Health Association, and our stance is that as long as it's coming, no matter what, the state has approved it. As long as and they pay attention to any of the food preparation rules, we are still subject to regulate any of the foods. However, it is the Massachusetts Association of Health Boards, MAHB, their lawyer says that it is also under our purview that we can create a local regulation from the Board of Health side to ban certain products and to create limits on what we would like to see on products. So that is possible as well. And then on Monday, Kopelman and Page will be here. I think her name is Katie. Katie will be here with a presentation from Medwell, I believe, which is one of the medical marijuana. And what they're also saying is that there is a possibility for us to create types of bans of other types of products, so like gummy bears, candies, things like that.
So we could
prevent
do that.
So it's a question of whether or not us as a board of health wise, would we also put our own set on retail marijuana. We had discussed medical marijuana a little while ago, but retail has never really been talked about here.
I have a question and then some comments. I was reading through the regulations and it talks about certified lab.
Yes.
What is that lab doing exactly? There was a lot of definitions, but it wasn't very clear what they did.
Yes, the certified laboratory is certified by the Department of Environmental Protection to do chemical analyses. And what that lab is looking for is to certify the amount of THC, CBD, and the other alkaloids that are found in cannabis, or as I like to call it, marijuana. Cannabis is really a marketing term. It sounds less intrusive. But in marijuana, there's a couple of psychoactive substances called cannabinoids, which is a type of organic molecule within the flower of marijuana, which is what people smoke or eat. The two specific cannabinoids that they're going to be testing for is THC, the tetrahydrocannabinoid, which is what gets you high, and then the CBD, the cannabidiol, which is the one cannabinoid that has proven medical properties. It is currently going through a FDA.
Maybe prove it. I'm sorry.
Sorry, that's a good point. That's an excellent point. That it's going through a clinical trial. They haven't.
There's no
Proven.
double-blind, randomized,
Yes, they have not done
statistically
that.
valid trial.
You're absolutely right.
It may be true, but it's not.
Yes, there is one product going through the FDA process right now.
Okay.
That is CBD based. That's the only one that potentially has medical effects. So
So when the lab does this testing, will they do it before the products are sold?
they actually, unfortunately, no. That is not
So,
the
so
way.
why are they doing it at all?
It's kind of a quality assurance process. So
guess-
they're random sampling.
My issue is essentially it's a drug.
It is.
In most markets, even over-the-counter drugs, which essentially this will become, have a specific concentration of the active ingredient labeled.
Correct. And that's what they're supposed to do. So
But they're going to do it retrospectively? I mean, I have problems with this
there's many flaws with this
because, I'm not going to get into philosophy of marijuana, but just from a scientific pharmaceutical point of view,
There's a lot of flaws.
this is a drug that does not have the labeled concentration. So you could have no THC, you could have a lot of THC, you could have THC with somebody else's put something else in there.
I wholeheartedly agree with you. There's the way the regulation is written. There's no specific time frame of when the lot is allowed to be released for public consumption. So they can create what essentially is a 25% concentration of CBD oil, sell it, and then send their sample to test.
See,
And it can already be
crazy to me.
consumed at that point.
Who is responsible for the running of these labs and for overseeing them?
The oversight of these labs is the Cannabis Control Commission.
Okay.
A little variation on the labs for Nantucket and the Vineyard are we will not be using the state certified labs because of the federal regulations against transport.
Who are we going to do?
It'll be done on a local basis
By who?
by
don't have anybody
by
yet.
the people that
Sell it?
sell it. I guess. I mean, while they'll be testing, and I'm not sure the rigor of it, while they'll be testing for the THC and the CD, whatever, they will not be testing for everything that's tested for in the state certified labs, such as herbicides, pesticides, and another side. I don't remember what it was.
But other
last night.
drugs too.
Yeah. So it's a less rigorous test than that's going to be offered to people getting the product here.
And the other issue,
other
so
places.
that has to do with the supply chain.
It's a supply chain issue. Yes.
There's a supply chain issue. So we have a drug and food that will not have a very regulated supply chain or concentration of product.
Which is really the point of this discussion, is because we would need to create our own regulation to
So
require the testing.
we could do that.
We are allowed to do that under Chapter 111, Section 31.
So we could do that, or we could insist the lab on the island has a certified laboratory by all the standards of good laboratory or GLP,
Yes.
good laboratory practice, et cetera, et cetera.
But the state has given the islands an exception. They don't have to be a state certified lab.
But would it have to be a Nantucket Board of Health certified
No,
lab?
we could.
That's right.
Your
Or
board,
at the
yeah.
minimum, I mean,
yeah.
there's a thing called good laboratory practice, which is kind of standard laboratory SOP and etiquette and regulations. I mean, no lab that's dealing with food or drugs should not be GLP standard.
We have met with two of the three applicants, the Green Lady and I forgot the newest applicant, Mr. Sullivan, Mike Sullivan's application. We have met with them. When we brought this issue up to them, they are agreeing to test their products first before they distribute any of it. They want to maintain a good product. The other applicant has not met with us, will not meet with us is more like it.
So theoretically, we could require that the products be tested before it's sold?
Correct.
Oh, that would...
But where's the quality control? Who's responsible for that, and who's paying for it?
Unfortunately, the state allows for that exception in the islands, that exemption. On the mainland, that quality control is done through the
By the
DEP
state.
certification.
Yeah, well-
and
What is the state's reason for not making the island come to the same
transport.
standards for the rest of the state? What is
It's transport.
because of the transport, the boats and the planes are federally regulated, and this is still a Schedule 4 drug,
Oh, okay.
and it is illegal for them to bring it on the boats or in the planes.
But
they would
we
get
as
arrested
a
for trafficking.
board, we as a board can make the testing meet or exceed what the state is if we want.
We can meet or exceed, but exceed up to a certain level. If we make it too onerous, they can appeal it to the cannabis.
So we can
control.
make it at least meet the state
At least
standards.
meet the state.
Yes, I can't imagine an onerous test of a good laboratory practice and knowing. I mean, the customer and the product should, and the people should know what they're taking before they take it. I would think,
I agree.
and there's
And-
nothing onerous about that.
The other topic that I've been mulling around is my colleague at the FDA. I asked for his opinion on this as well. And the FDA's standpoint on any of the food products is that by adding CBD or THC to the food product, it is officially declared an adulterated food product.
Exactly.
And we are allowed to seize it and destroy it by federal standards. So if it doesn't meet our standards at any point, regardless of what the Cannabis Control Commission says, we are allowed to prevent it from being sold.
All right. So what's the issue? The town meeting coming up.
With the town meeting, because we have the moratorium in place, it gave us time. The moratorium was a vote to give us time to create planning and zoning regulations,
Okay.
which have to go to town meeting to be
Right.
voted in, and also time for us to
Think
for
of
the
it.
select board, for the board of health, and for the other governing boards to look into our concept of regulations on it too.
Well, I think I've been very clear what my concept of the regulation would be.
So I'll start.
It's not
I'll-
banning marijuana, it's just making it safe for the public.
Exactly. There's been no studies on what a minimum effective dose is, which is a basic pharmaceutical study. So we don't know what the marijuana minimum effective dose is. The MED on marijuana hasn't been found. We also don't know what the dose response curve is. So we don't know what the maximum allowable dose is either. None of that science has been brought down.
So how would we even?
So
I mean, so we could make a regulation that says you have to put the concentration of THC on the package, but that may or may not be any good if we don't know.
we can ask them to put the concentration on the packet, but
Yep.
ultimately, if they want to sell a brownie that has 55% concentration of THC, of active THC, they can.
Is there any community in the country that has looked into this or putting labeling on the package, which is kind of basic consumer product protection?
California requires the labeling on the packet of all their medical products. And I believe Colorado requires the labeling of the product. Massachusetts you have to be able to find the concentration, but they don't have to put it on the product label. So, for example, the dispensary in Brookline has all of the chemical breakdown on their website, but it's not on the
So is California or Colorado, that's far ahead of Massachusetts, done any look at what minimum effective dose and maximum effective dose and what the dose response curve looks like?
not from a reputable scientific source. The industry is looking into it, has been doing it, but it's the same
Well,
thing that's happened with the
I
tobacco
wouldn't mind the
studies.
industry doing it if they did the usual proper standards of scientific experimentation.
That's been the problem. Every article that they release is peer reviewed by other cannabis
Right.
industry people, so they're releasing it, and they're more like white papers rather than
They're not.
true
They're
journal.
not scientific papers.
They're not scientific papers.
I can't imagine that no one at some point hasn't, from a scientific perspective, looked at this.
There has been a small amount, but it's for specific products like Marinol, which is the only FDA-approved marijuana product, but it's specific for the compound in Marinol. They haven't done it for any of the other things because
Right. There's been no reason because there's no one's been asked for approval.
It's not just that. Is people believe that the marijuana plant is the medicine, when anyone who's ever studied any of this knows that a plant is not the medicine.
Right.
It is the alkaloid inside that. The
plant.
chemical composition is the medicine. And they would have to create minimum effective doses for CBD, THC, THCA, THCC, all the different types of, and it's an extensive research.
So it'd be easier just to synthesize the THC
I agree.
and sell that appropriately.
Which is what they're trying to do.
So I'm trying to, as a layperson, maybe make an analogy. So is this like me going out in the forest and finding the digitalis plant and picking it and whatever, figuring out a way to smoke it and not having a clue about the impact it has because of dosage and things like that?
Yeah,
Or
it's like the same. I mean, digitalis, this came from a plant.
that's what I mean. Yeah,
And
right.
actually,
Isn't it
there is a
digitalis
dose response
plant?
for it. Yes.
So so what we're doing is it's like we're taking these plants. We get a lot of our medicines from plants, right? I
Well,
mean,
quinine comes from Peruvian bark, and if you go back to the early 19th century, it was very, very expensive because it was effective. But there was no real standardization of dose until the mid-19th century. U.S. Pharmacopoeia was formed, but they had no regulatory authority, so it wasn't really until about 1920, 1930 that there was any kind of standards in this country for anything. But most herbs, well, I think digitalis, I think the cancer drug, which slipped my mind, quinine, all come from plants, but the active alkaloid has been removed, synthesized, and purified.
So let me ask you a question. How does anyone know when a certain amount is too much? For instance, I know this might sound far-fetched. If a policeman pulls a guy over and he thinks he's been drinking too much, he has a test, he can give him a breathalyzer in 0.08, okay? Now, someone that's high on marijuana, a policeman pulls him over. He has no guidelines. And he can't say, in my opinion, I think this guy was high. So where will the guidelines be for something like this?
And that's the problem. That's exactly the problem. They can't test for it. The only way to test for if someone is high is if they do a blood test. And the only way we can get a blood test is through a court order. If the person doesn't submit to a blood test,
Wow.
they don't have to.
And then if you submit the blood test, as we've discussed, and that no one knows what the dose range is.
And there's
Right.
no
Concentration.
Yeah,
there's no standardized concentration.
I know. So a
I'm
policeman
going to
can't
have
go
to
into-
look. Yeah, I'm
A
sorry.
policeman can't go into court and say, in my opinion, I think this guy was high in marijuana, because one guy might smoke have one thing and he's over the hill, and the other guy can sit there all day long.
And that's the sense. Even then, if if you do your own case control study on your own body, if you smoke we'll say you smoke one joint with a concentration of 5%, and then the next day you ate exactly the same food, it was the same temperature, your whole night, if everything was equal, but you smoked a 20% concentration joint, the reaction will be completely different.
Yeah.
Because the dose is different. Even if you standardized everything else, that single dose is so different that your reaction will be that could be up to 10 times stronger depending on what you've eaten, what you haven't eaten, what your water concentration in your bloodstream is, whole nine
Yes,
yards.
and dose response curves are not linear.
So
Yeah.
so
They tend to
then
be sigmoid.
They're very sigma.
so
you
then
could-
what
you
do they do in the mainland as far as is what the limit is?
They haven't set one.
So they haven't said it. No one.
There is no
nobody knows.
enforcement limit, and that's the problem with Colorado right now, where the governor has threatened to rescind that law, to rescind the recreational marijuana law, because it has gotten out of control. There have been spikes in accidents and marijuana overdoses,
I can believe that. Yeah.
and they have no way of combating it.
Right.
And Chief Pittman shared that with the select board, the increased incidence of arrests related to as a result of the
Right.
So
All right. Well, I have some homework. I have to go look at this
I would
literature.
I would be happy to work together on something.
I need-
a policy brief at the minimum.
Yeah. Well,
So the board solicited input from a number of organizations, and I thought this is even better than I thought it would be, because I just thought it would be like, do you think we should do retail marijuana or not? But this would be fascinating to.
well, I'm not going to get. I mean, marijuana is here, and for some people, medically at least, it's important in their therapy. Now, I don't necessarily. There's not a lot of literature cures all the diseases, it's going to say, but it's part of a medical program. And it's, if we allow people to drink alcohol,
Right.
we should allow people to smoke marijuana, but they should smoke it in a safe way with standards, the same standards for alcohol. That's labeled, tested, et cetera.
Right.
And food. That's my opinion.
Yeah. It can't be like the Wild West out here. You know what I'm saying? You got
It unfortunately, we're paying catch up. When the state decided to put this on the ballot, they rushed it, and they rushed it to the point that there is now an entire active industry on the ground running with no regulation.
right.
And one of the things the board's talking about is should there be any limitation on the number of outlets? Recently, we found out another concern we have is that they're going to be promulgating regulations on the distribution or the transport, I guess, of marijuana, including home deliveries. So we have, concerns about that. Trying to figure out what limitations a town can put on. We hadn't been talking about the Board of Health. So it is, as Roberto says, it's very complex. It's changing, and the industry has hired some very able people to represent them.
And the industry has moved so quickly that there are more. I don't know how true this number is, but it is what was one of the things I heard at MIHA. There are more botanists in the state of Massachusetts working on marijuana now than any other botanical research, because of the dose, trying to standardize plants so that the plant will consistently bud at the consistent concentration. So they've got it down to such a science now that the marijuana people are consuming today is almost 100 times stronger than the marijuana that was being consumed in the 60s without the modern genetic
Well, actually,
manipulation.
you could engineer a plant to produce the same. I mean, today's technology would be actually quite easy to produce a plant that's consistent.
They've done a genetic manipulation on one of them that's been approved in Massachusetts already in the Brookline store, that has a 0% THC concentration and a 34% CBD concentration. It's just something we never really expected. What that means is that it has 0% of the psychoactive substance, so it does not get you high.
But has the
But it-
potentially medically active substance.
So but because it's illegal to market it as a medicine, they're marketing it as a supplement.
As a what?
As a supplement.
Supplement, yeah.
So basically, what they're marketing it as like a vitamin B,
Right.
because that's not FDA regulated.
Fascinating. All right.
It's really fascinating.
Any other comments on this?
No?
I think we have to think about this.
I'll get to work on collating some of the research,
Yeah.
finding what the effective doses are, and critiquing some of the articles to see if it is scientific.
Well, I think at the minimum we need, as I said, a standard lab to label whatever our citizens are going to be smoking and drinking.
Is there a time
Initially.
that our opinion is requested? Is there a timeline or
Not-
deadline? I mean, or something that we're aiming for?
Not exactly. It's just so that the moratorium is over in December.
Right.
So,
But this
you
is
know,
coming to the October special town
it is,
meeting, right?
But
Yeah.
what's coming to the town meeting is the discussions about do we want cafes, how many do we want, where are they located, that sort of thing. 'Cause it's the zoning and planning regulations that have to go
Then
to town
again,
meeting.
making those decisions without this
Right.
information is, to me, it's
So
a cart
the
before
board
the
will
horse.
be is starting to discuss what articles will go on town meeting related to this and other subjects, and the warrant will need to be published by sometime. It will need to be finalized sometime in July, or the end of July. In terms of warrant articles. So as every week we have board members give committee reports, and so I typically talk about what we've discussed. So what should I say next Wednesday?
Well, you can said, like Roberto said, there's, I think there's concerns that
We have
the
dosage
exemption
concerns.
of the lab is all right unless the lab on this island has good laboratory practices and uses standard standard acceptable procedures, and should be inspected by somebody.
It'll most likely be us.
Should be inspected by somebody and certified, and that at least the chairman believes that we should not be selling any product to the public, food or drugs, that is not properly labeled. And that it would be nice to know about dose response, but that's not going to happen in the next few months. But at a minimum, we should be labeling our products. And nothing should be sold unless it's properly labeled. That's basic rules of health. It's a health issue.
Thank you.
Anything else?
No.
It's an interesting conversation.
And I'm not even going to get into the supply chain. That's another. Anyway, so not any other discussions.
Nope.
Do we have any other questions, actions? If I hear no objection,
I just have one question
yes.
for you. Did you ever track down who dumped the paint into the sewer?
No. They were able to track it down to a specific set of blocks of where
that's
it
it.
happened, but that's it. There were like 4 companies that were working on that block that week.
And
So
no one admitted to it.
of course not. Yeah.
But the problem is escalating.
Yeah.
Oh, it
The
is?
sewer director last night reported that there's more paint being dumped this year than any other year. That 1 gallon of either turpentine or oil-based paint can disrupt the biology of a sewer treatment plant of 66,000 gallons flow a day, I guess.
Wow.
Sconset is 28.
oh my God.
Wow.
We're having now problems at the wastewater treatment plant in Surfside, and this stuff is going out in the stormwater systems. It's going into the harbors. So
It's a real concern. We've started a campaign to release information in English, Spanish, Portuguese so far. We have a bunch of flyers that are being put out. I have a stack of them on my desk that we'll be distributing to areas where people who paint tend to frequent. So
Can you put flyers or something like a marine home?
That's
center
exactly
by
what they're
the
doing.
paint?
That's exactly what
Just,
we're doing.
put a warning and just.
That's exactly what we're doing. Going to Marine Home, Island Lumber, Cumbies, Fast Forward, Espresso to Go, where we see a lot of the painting groups congregate.
So you'll put them up in English and Spanish?
And Portuguese.
And Portuguese, yeah, okay.
So we have the little flyers. You may have seen some of them around. I saw some at Fairgrounds today.
Oh, did you?
So they're
Well,
there.
I didn't think it was that bad.
It's always, we've always been seeing it. Last summer, there was somebody who dumped around 4 or 5 gallons of white paint in a catch basin on Center Street, right in town, in front of the Jared Coffin House. We've been seeing it, but usually what we usually see are latex-based paints, which is an acrylic paint, and that dilutes in water, and it's a lot less toxic.
Right.
This year, there's been a huge surge in oil-based and turpentine and mineral spirit-based paints.
I didn't think people used oil-based much anymore.
I didn't think so either. The standard was acrylic, water-based, and latex-based, but now there's a resurgence for some reason. Personal opinion with David Gray and I, we talked today actually. We think that it's with the new trend in the antimicrobial paints. There are paints that Sherman-Williams, Behr, and I forgot the third company that just came out that have
You can antimicrobial
that have
paints,
paints
just
that-
what to put in there. Right?
exactly. They're paints that are made to stop mold from forming in your walls and to stop bacteria and things from getting into your walls. As a result, when people dump it, they're probably these oil-based, enamel-based paints that are extremely dangerous to a treatment plant.
Okay.
Should the DPW maybe have hazardous waste things more often than they
Rob-
do?
They're going to do that.
That's exactly what Robert's looking to do. He's trying to get it done so that he's trying to get approved so that we can have one of those
Drop-offs?
a drop-off center
Yeah,
that's
absolutely.
open year-round, and then when we get clean harbors out
I think
there,
that's probably half the problem. The guys get through the job and they don't want to lug a half a gallon of paint or a quarter of a gallon of paint around with them and wait for 2 months to take it to the.
that's what they think happened because it was 15 gallons all at once
Yeah.
that they got. So they think it was one of those carboys, a waste carboy, where once your oil is just too gross to clean they've been pouring it into this waste container. Once that waste container filled up and they didn't have a second one,
Right.
they just emptied it.
Yeah.
So that's what they think happened.
Okay. Thank you all. Hearing no objections, we will adjourn until next month.
Thank you.